An IUD is a tiny T-shaped plastic or copper device that's inserted into your uterus to provide long-term birth control. The IUDs are divided into two main types: hormonal IUD, copper IUD. Hormonal IUDs release small amounts of the progestin hormone into your body. This hormone makes the mucus on your cervix thicker and blocks sperm so it can't get to an egg. The hormones in your IUD can also stop eggs from leaving your ovaries. These types of IUDs tend to make your period lighter and shorter. They may be a good option if you have heavy periods. With hormonal IUDs, your period may become less frequently or stop altogether. Copper IUD is wrapped in a small piece of copper. Because sperm does not like copper, they avoid the IUD. The copper alters the cervical mucus, making it more difficult for sperm to reach an egg and survive. It can also stop a fertilized egg from being able to implant itself, which prevents pregnancy. Because copper IUD doesn't use hormones, women using this IUD continue to get their monthly period. It can be put in at any time by a specially trained doctor or nurse, as long as you're not pregnant. The procedure starts out similar to getting a pap smear. The doctor will place a speculum in the vagina to hold the vagina open. The cervix will be clean with an antiseptic solution. A tenaculum used for stabilization and traction of the cervix. A sterile uterine sound may be used to determine the depth of the uterine cavity. The doctor will put the IUD in a small tube that they'll insert into your vagina up through the cervix and into the uterus. Then they'll push the IUD out of the tube and pull the tube out. Strings attached to the IUD will hang 1 to 2 inches into the vagina. The strings soften the longer you have the IUD and can be trimmed shorter. Your partner shouldn't be able to feel anything, but if they do, it will only be minor contact with the IUD strings. Although the procedure is uncomfortable and you may have cramps and bleed, they tend to go away in a few days. Your periods can be heavier, longer, or more painful in the first 3 to 6 months after an IUD is put in. You might get spotting or bleeding between periods. If inserted correctly, IUDs are more than 99% effective. It works as soon as it's put in and lasts for 5 to 10 years depending on the type. It can be taken out at any time. It's then possible to get pregnant straight away.